Welcome again to my channel. My name is Chrysa Vafeiadi and I'm a certified physiotherapist. And today I'm going to talk about what we should do after an Achilles rupture as a physiotherapy protocol. So usually an Achilles rupture may happen even in an athlete, if you are a football player or if you're a basketball player, like in sports that you're putting a lot of strain on your ankle, or if you have a job that you have to stand up on your feet for longer time, and if you do that for years. So what we should do, first of all, we should be really careful of how we're going to progress the rehabilitation, and you should always seek advice from your physiotherapist and from your doctor before trying anything. So those videos that will follow are just for advice. You shouldn't practice any of the following exercises if you haven't seek advice from your physiotherapist first. To start with, we're going to talk about general things. The first video is what you should do weeks 2 to 4. So for the first 4 weeks, the goal is to decrease the swelling and pain. So first of all, you should apply ice. And you should apply it for 5 to 10 minutes every 2 to 3 hours. And you should wear a boot. Usually, it depends on your surgeon. The surgeon will give you a boot that places your foot plantar flexion position, which is this, and gradually it decreases the degrees of the plantar flexion, and by the end of the 7th, 8th week usually, the foot goes flat, so in 90 degrees as per normal. But that's what usually happens. That depends on what your surgeon has done and what are the goals for your surgeon. You should wear the boot when you are outside your house, and you should have crutches. As far as the weight bearing concerns, for the first 4 to 5 weeks, we do only toe touch and with the boot. After the 5th to 6th week, and always depending on your surgeon, you start putting gradually more weight on your foot, but you should use the boot still. And usually we remove the boot on the 7th week or 8th week, and you start putting more weight in full weight. So full weight should start after the 6th week with the boot, and then gradually you should remove the boot. But that's always general advice and a general protocol. Every patient is different and it depends on your surgeon. So as I said, you should seek advice from your surgeon and your physiotherapist before trying anything. As far as exercise is concerned, you only do some isometrics, which I'm going to show you. But again, for the first 3 to 4 weeks, only passive movements that your physio will do. Physio should help you to decrease the pain and the edema and the swelling. And how you can do that? You can do that with the use of TECAR, which is really good, and also with some techniques such as the scar tissue release, which you can use ergon, or with some gentle massage and some soft tissue techniques. But again, your physio is the one to advise you. So you don't do any active movements, only passive movements. But around the 3 to 4 week post-surgery, you can do eversion and inversion actively, but you should be able to keep your foot in neutral position. So you need to avoid having a plantar flexion or a dorsiflexion, because we don't want to strain and we don't want to stretch the tendon because it's still too early. As far as the isometrics of inversion and inversion, you can actually do this exercise. So you should have somewhere to place your foot. You should have your foot in neutral position, which is around here. So we don't want this, we don't want this. So neutral is here, and you can apply some pressure and hold it for 10 seconds. So it's like you try to do this movement, but you don't do it. You hold it for 10 and you relax. And you can start with 10 repetitions, 3 to 4 times per day, and increase this accordingly. And then the other isometric is like you want to do eversion, which is this movement. So again, you keep your foot in neutral position, you do this, you hold it for 10 seconds and you relax. And if your physio advises you to do it actively, again, you should keep your foot in neutral position and try to do this movement. So this is the inversion and this is the E version. And again, you start with 10 repetitions, 2 to 3 times per day, and then you increase this gradually. But again, as I said, you always need to seek advice from your physiotherapist before trying any of those exercises, because every patient is different and every type of surgery is different. I hope that you enjoyed our video. If you did, please press like. Stay tuned for more, because there will be more videos that will follow for rehabilitation of the Achilles tendon after a rupture. And subscribe to our channel for more.